Klauer here. Today we're going to talk about cluster headaches. And in my training, I'm mentored by Dr. Stephen Olmos out of La Mesa, California. And I thought, what better than to reference his manual as we talk about cluster headaches today. If you want additional information, please feel free to shoot us an email. But I'm going to go through some of this data here, explain a little bit about what cluster headaches are, why we think they happen, and what treatment modalities are out there for it. So cluster headaches are considered the most painful of all primary headache disorders. It predominantly affects men in a reported ratio of about 6-to-1. And the headaches, they attack in clusters over weeks or months. So there'll be periods of nothing, and then they'll kind of come back and forth with vengeance. And usually it's between 20 to 40 years of age, but we do see it in older individuals. They have a remission period of about 14 days, and they can last for months or even years. And some patients can even get them daily and continuous, where they're lasting for long periods of time. The remission periods can sometimes be for months, so it can be tricky where they'll have this painful attack and then it'll be quiet for a while and then come right back. So the clinical signs and symptoms that we typically see with them is it's a rapid onset, and it peaks within about 10 to 15 minutes, and it may last for 2 to 3 hours. So this is the headache that's described as someone's head is hurting so bad they're kind of nodding back and forth, and they want to bang their head up against the object just to help take away some of the pain. Typically it's unilateral, so it's on one side. And you can have tearing in the eye, and that's a very common sign or symptom of it. And you can also feel nasal stuffiness or dripping of the nose, drainage of the nose on that same side. And you may also have some visual disturbances and changes. And that's happening because of the interaction between some of the nerves that innervate the eye and those facial structures. So the pathophysiology of it is that it's of central in origin, so it's happening with the central nervous system. And so really the key is getting an accurate diagnosis. Now, patients are often awakened from sleep with them, and it happens at almost the same time every night. So when I've had patients come in with them, usually their history kind of hones in on the diagnosis because they're waking up at the same time and repeatedly, and it's also seen to happen in REM, deep sleep. So as we evaluate our patients, we're always asking questions about sleep and if there's any disturbed sleep patterns going on. And so this would certainly be a hallmark sign. Now, one of the best known treatments for it is oxygen. And so management of them or abortive treatment for it is just taking oxygen, utilizing oxygen at night, and that is abortive to the cluster headache. In addition to that, there can be prophylactic treatment where you're taking some of the common headache medications. Based on the pathophysiology of it, we know there's a relationship with our circadian rhythm with them being repeatable at nighttime. The management of treatment of this, there can be abortive or prophylactic. In the abortive situation, you're using oxygen at 7 to 10 liters per minute, and that can help stave off some of the attacks on that. And then other things like verapamil on a prophylactic standpoint is being used for those cluster headaches. So first and foremost is getting an accurate diagnosis, and then with your medical dental team, whoever's treating you, talk about the different treatment options that are out there to address that cluster headache. If you want more information, click on the link below, and we'll give you some added insight into cluster headaches.